when COVID came in, most of the people were like shocked. And with that one patient story, the school was closed at Paramacatai. It shocked the people. Well, some believed that they're going to die. Well, some said we're going to survive. Some said we're going to take the vaccine. Some said we're not going to take.
One of the biggest issues that emerged in the aftermath of the global COVID-19 pandemic was what was seen as the constantly changing narrative coming from both the health authorities and other sources. This prompted many to be skeptical about taking the vaccine because they felt that they were not being told the truth.
They were getting information from the net and telling others not to take the vaccine. Some had beliefs, religious beliefs. Some had their personal belief that they don't want any vaccine due to from what they are reading on the net, which I think personally was not true.
In fairness to the health authorities, the COVID-19 virus was as new to them as it was to the rest of us. And let's be clear, they were struggling to understand what was happening while searching for a solution. And they were racing against the clock. People were dying, and the COVID-19 virus was spreading fast. So as new information emerged, it was made available to the public.
The WHO Director General announced COVID-19 as a pandemic. Countries should focus on communicating with the public at every stage.
In Region 8, some members of the community relied even more on their traditional remedies.
COVID had an effect on the village, on the people very well. We were using bush treatment. That is why nobody really was severely ill with it. I had it, although I'm a medical personnel, I still divert to, what I know in bush treatment.
But nationally and internationally, vaccines proved to be the solution. And over time, we've seen that vaccines work to get us back to normalcy. Many people were concerned about the adverse effects that could result from taking the vaccine.
Religion had a lot of influence in this thing, so they're not going to tell me it is since then.
Worldwide, only a minute percentage of persons face this challenge. And it is recommended that persons with underlying conditions check with their doctor before taking the vaccine. The COVID-19 vaccination program led to a very large number of people being vaccinated in a relatively short period. And this led to the reduction of deaths from COVID and has allowed our communities to start functioning again. With genuine respect for people's religious beliefs and their use of traditional remedies, we know that COVID-19 vaccines saved lives. While it may seem that we've gone back to normal, the emerging new strains of COVID indicate that we have to continue to be vigilant and check credible sources only for information, like the Ministry of Health and PAHO WHO website. It still makes sense to get vaccinated to protect yourself and your family as these new strains emerge.
The people in my community, they are moving forward with their life. The people are free, they're moving free, the roads are no longer blocked, and they're trading across there to Latam, to Brazil, they're moving on.
If you have not taken the COVID vaccine, speak with your healthcare provider and think again. Remember, vaccines save lives.